Are you a go-getter in your profession and at home, taking care of everyone but forgetting to prioritize yourself? Welcome to the Healthier Go-Getter, the show that brings together health professionals and wellness experts to bring the inside knowledge to empower you to take charge of your health and elevate your wellness game. Let's become go-getters for your health so that you can bring more joy to your life and your loved ones.
Can you expanding on that to explain to our listeners, like what is acupuncture?
Well, basically, acupuncture is a system of medicine that's been practiced for a couple of thousand years, with its own paradigm of understanding, theoretical ideas of disease causation, and correlation to specific treatment methods according to that particular paradigm of understanding. But basically, in modern times, how acupuncture is understood is just the stimulation of particular points that underline those points.
Before our show started, I'd like to thank our sponsor, Elysian Wellness Aesthetics. It's a locally owned clinic specialized in regenerative and rejuvenative medicine. They are your one-stop shop to look and feel better. They offer medical weight loss, hormone balancing, Botox injections, laser service, skincare, and many more. Check out their website at www.elysianwellnessokc.com for more details about their service. They will love to see you over there. Hi everyone, my name is Margarita. I'm your host today. Today I have a very interesting guest. His name is Gabriel Fuentes. So since he has a very long bio, then I will let him to introduce himself because it's super exciting. And then I want to make sure that the format should be correct. So I let him to introduce himself. Hi, Gabriel.
Oh, sure.
Yes.
Good morning.
Can you introduce yourself a little bit to our audience?
Yes, my name is Gabriel Fuentes. I'm a practitioner of Chinese medicine, graduated from Dallas College of Oriental Medicine in Texas in Dallas, and went to Taiwan like a year after graduation and studied Chinese language and studied at China Medical University. Then I became a lecturer at China Medical University, and I was there for about a long time, close to over 14 years, basically. Yeah. I've also studied and done research mostly in mainland China and Korea.
That's amazing. Right now, you also practice on acupuncture in OKC.
Yes, in Oklahoma City. Yeah, I practice. I came back in 2018, and I was just going to renew my passport and go back to Taiwan, but I was convinced to stay and open a practice here, and I've been here ever since.
Nice. Yeah. Welcome to Oklahoma City. And we are so glad that you're here.
Yeah. I grew up here, actually. I came here very young. So
really?
Yeah.
That's
I came
amazing.
here when I was 13. So I'm a transplant Okie.
That's really good. That's really good. So you have a very, very interesting background. So I know, how many languages do you speak now?
I speak 4 languages.
4 languages?
Yeah. I mean, my Spanish, obviously, I grew up speaking it. So that kind of doesn't count according to some of my friends. But just Spanish, English, Chinese, and some Italian. Yeah.
Oh.
But my Chinese is by far much more fluent than my Spanish now. So.
Wow. That's so amazing. Ni hao.
Ni hao. Ni hao.
Yeah. Yes, that's so amazing. So,
但是我的中文退步了。
中文退步了。You need to speak a little bit more. Okay. So now I want to know, I think there are a lot of people don't understand actually about acupuncture since you've been in China for many, many years and then you've been studying in the traditional Chinese medicine along with acupuncture. Can you expanding on that to explain to our listeners what is acupuncture?
Well, basically, acupuncture is a system of medicine that's been practiced for a couple of thousand years with its own paradigm of understanding, theoretical ideas of disease causation, and correlation to specific treatment methods according to that particular paradigm of understanding. But basically, in modern times, how acupuncture is understood is just the stimulation of like particular points that underlying those points, there are nerve endings, peripheral nerves that are stimulated to cause a particular release, like endogenous release within the body of like endorphins and enkephalins and anti-inflammatory factors that all kind of contribute to a gradual healing of the body as treatments are performed.
Nice. This is very interesting. So now, what are common diseases that the acupuncture can help?
Well, there's a slew of diseases that are talked about in ancient texts, but my experience when I was in the hospitals in Taiwan and Korea and China is that, there is a focus that most practitioners in East Asian countries use acupuncture for either pain, strokes, especially strokes is very popular for strokes because the efficacy is very obvious. And facial palsy, neuropathy, like especially diabetic neuropathy, those things are actually quite well treated with acupuncture in East Asian countries. And as a matter of fact, that's what keeps most acupuncturists busy in East Asian countries are things like obvious, pain, musculoskeletal pain, lower back pain, sciatica, strokes, facial palsy, neurological conditions like that. Yeah.
Is it more like nerve-related issues? Is that correct?
Yeah, many are nerve, but also muscular.
Also muscular. So in terms of muscular, can you expanding on that? What type of like common symptoms that muscular issues that you guys can be able to help?
Just general soreness, soreness, sometimes pulling up the muscles, like I've had a few patients that they're doing hard labor, or sometimes it's just a freak accident. They turn a certain way and they pull a muscle and they can't get up or they can't move. So it's very effective for those types of conditions.
So I think in common, people will compare the acupuncture with dry needling, right? So what are the difference between those?
Well, dry needling is something that's been, pretty much developed in the West. Well, not only the West. There's research that was out of like Korea and Japan, and also China. But basically, Chinese medical system is based on a theoretical understanding that's based on particular texts, and it's based on the understanding of the channels and network vessels within the body, right? Whereas dry needling is mostly focused on musculature and activating motor points within the muscle.
A lot of people are confusion sometimes, like, what is the difference between acupuncture and then dry needle? So which is really good that you explain so people understanding about that. For me, it's like very, very interesting to asking you, since you speaking multiple languages, like what are patients come from? Are they more speaking Spanish speaking, English speaking, or Italian speaking, or maybe even Chinese speaking?
I have a little bit of everything that comes in. I mean, people that come in, excuse me. I have a percentage that is Chinese, a percentage that's Latino and Anglo-Americans. I have everything. African-American. Whoever needs it, I treat them.
Yes, that's good to say for sure.
And if I can, if they speak any of the languages I speak, I can definitely communicate better with them.
Oh, Yes, that's really helpful for sure. So I have a question. Is like for me, it's quite interesting to see your journey. You're from Puerto Rico and then moving to United States, and then go to Dallas in the
Yeah.
university, and then when Taiwan, China, Korea,
Yeah.
with all of the countries, like who inspired you to become more like interested in the Chinese traditional medicine or acupuncture?
Well, I was born in New York City. A lot of kids, they were introduced to martial arts when they were younger. And in New York, I used to take the train all the way to Canal Street, which is our Chinatown downtown in New York City. And I was just kind of just fascinated with East Asian culture, from a young age, I think. And when I came to Oklahoma, I was studying Taekwondo here and grew up with a lot of Koreans. And one of my teachers, actually in the early 80s, he practiced acupuncture, but, he wasn't like academically trained, something that he learned from someone in Korea. And I remember when I was a kid and I would go to the Taekwondo school, some of the students would bring their parents or grandparents to get treated by him. So that's really what kind of put Chinese medicine on the map for me. Later on, I got into like body work and other modalities, but then I decided to go to acupuncture school. And at that time, there was, less than half of the acupuncture schools that there are now here in the U.S. Now there's like 60 something schools here in the U.S. But back then there were not that many. So I eventually moved to Texas to study acupuncture.
One of my friends that tell me that he used to be interested in acupuncture, and then he even enrolled in the college for that. And then when he was there, he asked the teacher, what is the acupuncture? Can you explain to me what exactly that do? They wasn't able to like explanatory very clear. So, and then he was, if I'm going to stay here for 4 years, and then when I get out this, I can't explain to other people, and how am I going to help them, right? So then he dropped out.
Yeah, it still is a big problem. I mean, I came back, education here in the U.S. hasn't really changed that much since I left. What really drives like good education is individuals that, even back then there were few, but there were still individuals that had spent time in East Asia and really kind of tapped into the reality of how medicine and the ideas of East Asian medicine is practiced in East Asia, where, when I went to school, there were basically only 5 texts that you go in. Actually, to this day, like there's basically 5 primary texts that are used for students to go through, to study and go through school. So you have the Zhongyi Jichu Lilun, and you have the Neike Shui, the foundations of Chinese medicine and internal medicine. Then you have the Materia Medica and the formula texts. And you may have a couple other texts, but that's pretty much it as far as, what students are exposed to in schools here in the U.S. However, when I got to Taiwan, and after a few years of being there, I started noticing that people in Taiwan, Korea, China, they are constantly reading. But when my students there, when they graduated, they had basically about 4 bookshelves. I mean, like the one behind me, like stretching out from the text that they had studied through their program. Granted, their program is by far much more extensive than Western programs. In Taiwan, you have a 5-year if you already have a bachelor's. Then the next after that is the 7-year, which is the Chinese medicine program, or the Zhongxi Jiehe, which is the integrated Chinese and Western medicine program. So the clinic alone in Taiwan, for example, equals in hours, in didactic hours, to the entirety of the school program here, which also includes their clinic hour. So it's a big difference to what students are exposed to compared to, Western students are exposed to. Because they're exposed to, for example, not just the science of it, but also like ancient classical texts. Like one of the classes that I went through was the Yi Gu Wen, the classical Chinese medical studies. And you have ancient texts dating from the Han up to the Qing. You have the Shanghai Lun, discussions on cold damage, the Huangdi Neijing, the Yellow Emperor's Classic, the Jingui Yaolue. You have also like the four great masters of the Jingyuan, Sidajia, the four great masters of the Jin and Yuan era. The exposure to a lot of like medical texts and medical ideas, it's by far much more than what Western students ever get. And also, I think I would add to that, like the way the transmission of Chinese medicine has come to the West has been quite decontextualized, because everything was quite simplified, after 1949. Things decontextualized in the sense of like, when you look at a modern, let's say a NACA book, internal medical book, right? You'll have like a disease, right? A modern disease maybe, or just a symptom like咳嗽, like cough. And then you have a pathomechanism of that disease. And then you have disease cause, disease pathomechanism, of course. And then you have a formula. One is probably from the Shanghai Lun or the Jingui. One is from Zhang Jingyue, or another one is from Shu Danxi from the Jinyuan era. So these are different formulas that are actually like from different periods in time. And they're presented as just formulas, decontextualized from the original author's ideas and theoretical frame of how he understood that particular formula. So the fallacy in that is that when students, modern students, especially Western students that don't have access to Chinese sources, when they try to use these formulas, they don't understand the original intent of the creator of that formula, or his theoretical framework by which he was using that formula, right? Because, you have different Shuepai, different schools of thought, and, you have Shanghan Pai, Jingfang Pai, you have the ideas of for the I Ching Pai, right? The classical school formula, which basically uses the framework of the Yellow Emperor's Classic, where you have other schools of thought which use the Shanghai Lun, right, or the 6-channel pattern identification to kind of view disease phenomena through that framework.
All of the things that you mentioned, if I don't learn, I wouldn't know deeply, right? So for me, it's like, I know in China, the traditional Chinese medicine and then the people who are practicing in the acupuncture, they need to get the doctor degrees in order to practice all of that. So it's very, very interesting compared to here is somewhere another recognized, and the other part is like very heavily emphasized. So definitely is very interesting. And then thank you so much for explaining everything that what you learned too, and to explain to the Western society, let more people to understanding about that. So with all of the knowledge, have you ever thinking about you want to go through the academic role, like teaching or something like that?
Well, I was teaching. I started a PhD program at China Medical University. I wasn't able to finish, but I taught there for as a full-time lecturer for 7 years. And previous to that, I taught part-time for about 4 years at both China Medical University and Tzu. Tzu is it's a Buddhist organization, but they have a medical college, or they have a university in Taiwan. And they have a Chinese medicine department as well as a Western medicine department there. I taught for quite a bit there.
Since it is my commercial in the middle, I want to kind of keep people like motivated and then entertained, right? So can you tell a little bit fun fact about yourself to our audience?
Fun fact? Like, I love to travel.
You love to travel?
I love to travel. Yeah.
What are the things that you did during your traveling time that you find out that was very, very interesting? That was very, very fun. What kind of unique experience that you have? Just one.
I would have to say unique experience. Riding my scooter in the mountains in Taiwan and
Oh, really?
stopping at these tea plantations and meeting the farmers and the owner and sitting down with them to have a meal and tea, the best tea in the world. Yeah, the oolong cha. Yeah.
Wow.
Yeah. Taiwan has some of the best tea in the world. I mean, there's many people that come from all over, even mainland China, and also to study like cha dao, the way of tea, which is quite interesting. But yeah, riding my scooter around the mountains in Taiwan.
Interesting for sure.
Yeah, it's beautiful. I mean, like,
Uh-huh.
it's quite a beautiful place. Yeah.
Yes. So I have a few questions right here. I want to know, like, so for example, I have few clients that who has very pain on their lower back and the hips, those area, and then sciatic nerve, and then make them like shooting down to their legs. So
Yeah.
they just trying to see, like, I did try, like, for example, when people come in, we're hoping with the muscle issues, right? We're trying to bring it down, like whatever the knots they have, and then hoping them to relieve the tension. So with acupuncture, can acupuncture treat those clients?
Yeah. Actually, I have a lot of patients with sciatic conditions, and typically they go and get a steroid shot. For the people that it doesn't work for them, the steroid shot, they have 2, 3. After 3, they just start trying something else. They'll come to me, and some people respond very, very quickly. Some take a little bit longer, but typically, by the 3rd treatment, how they will respond. One thing I do have to say is that with sciatica is that, like, you have really, really heavy, kind of obese individuals, it takes a lot longer, and a lot of times it just means them having to lose their weight. But typically sciatica, on most people will actually be very effective.
That's good to know. So with the people who has a sciatica, how the acupuncture will treat them? Like, can you explain in the words that how you treat the particular patients or clients?
Well, yeah, I mean, well, you do, traditionally you would just do like what's called in Chinese medicine, 辨证论治, right? Pattern identification and treatment determination. Right? However, for most musculoskeletal conditions, of course, you do certain muscle tests, range of motion tests, and then you kind of decipher where the pain is coming, the impingement of the nerve is coming from, whether the lower back or the glutes, and you select the points accordingly, basically, according to your findings. And what I like to use also is microcurrent stimulation, which adds another level of therapeutic efficacy to the needles. Yeah, getting the chi sensation, which can be quite uncomfortable sometimes for Westerners. And that's been something I have to kind of refrain from doing because, in East Asia, China especially, if you don't get the chi sensation, most patients will say, well, he's not doing it right. Where here, you get the chi sensation, somebody's flying off the table and they're saying, I'm not going to get this anymore. Here, I try to get it, but actually I found that using microcurrent stimulation is quite effective for that without having to really manipulate the needle and get that contraction of the muscle.
That's very interesting. With your practice, will you practice with the yin-yang system together? Maybe I'm wrong, so just don't call me on that. So, yes.
Yeah, well, what do you mean by that? yin yang
So
system.
a lot of people, they will know like, oh, Chinese or any type of Asian stuff. They were saying like yin yang system, right? You morning or nighttime or something like that. You working together, understand all your roots of routine, and then what's the morning does, what the evening does. You adjust there all your routines, so you're gonna help you to like heal faster, something like that.
Yeah, yin yang is just a theoretical way of like understanding polar opposites, throughout history. Like the yin was the shady side of a hill, the yang was the side exposed to the sun. But that was just a way to classify natural phenomena into two polar opposites, right? And then, of course, out of that developed Wuxing Shuo, the five-phase theory, which they call here five elements. But it's not elements. Elements are static. Xing, the Chinese Xing, actually is movement. So it's a phase, right? It's not like the Greek, four-element system.
A lot of people, what does the yin yang do?
Yeah, it's a good way to. They basically used it to differentiate things within the body. Like the surface was, of course, yang. The internal organs were yin. Above is yang. Lower body is yin. If you have a yang disease, typically like external waigan, external contraction, you feel hot. That's correlated with yang. It's the most rudimentary way of differentiating, if I can say that. Yeah.
Other question that I had from the people is they were saying that that's the acupuncture, the points, like the channel or whatever things that they're doing, will that really relate to the organs? The points really relate to the organs?
Well, I mean, unless you're targeting, spinal nerves that are actually innervating the organs, but not really. I mean, you see, ancient times, people, they did have an understanding of anatomy. It's just, for some reason, it stopped. I can't remember the dates exactly, but it stopped in China. The progression of dissection was only carried out, by individual physicians making observations during like executions or during executions. That was the most popular way of looking inside the body. 2,000 years ago, people, they didn't have an understanding of modern physiology like the way we do, the connections, but they associated ideas to particular organs, and these things were pretty much created out of imagination, or correlation, which they saw systematically being relevant in the sense that it was like like you can depend on like certain things happening, right? But it doesn't necessarily mean that it was the Western organ, because even in the Chinese literature, there's, especially many of the texts excavated at Donghuan, they have different texts having disputes over the wuzang liufu, the viscera and the bowels, right? Which are the viscera, which are the bowels. So it's clear that they didn't really, that sort of understanding developed as time went on, the correlation, because they only had the physical world to look at, what they can see, what they can smell, what they can palpate, to understand disease phenomena, and the human body, of course, So they made correlations, with what they thought was probably that particular organ, like a lot of people, when they get sen qi, they get angry, they'll say, watch your liver, watch your liver, don't get, or when they have like, sen qi, they, anger, right? So a lot of times it shows off as redness in the face, and that's funny enough. That's when a lot of like East Asian men will have like heart attacks when they have like get really angry. Their blood pressure shoots over 140. But yeah, these are going back. These are just correlations that were made that were reproducible. It was a map. I mean, there's modern research making some interesting associations, but I wouldn't say that they really had an understanding of how these nerves innervated the organ system. But one thing I do have to say, I think they were very clear from the beginning of Jing Luo, the channels and network vessels, because they, even in the Hanshu, they have a saying. We took an acupuncturist, an herbalist, and a butcher, and we filleted a man and observed the vessels. So they were looking at actual solid structures, right? They were looking at something physical. And I don't know how that got lost because, when I was a student, everybody was saying that it was immaterial. It was something that was there, and once you died, it disappeared. But they were actually looking at structures, and some of the descriptions of the points, with stimulation of certain points and looking for the radiating sensation, that was understood too. And you only get radiating sensation typically through nerve stimulation. So they understood this early on, and they were looking at physical structures. They were not looking at something that was invisible.
That's very interesting. Hey, we solve a misconception, right?
Well,
that's a lot of people. Yes, so this is really good to see the inside knowledge, right? If you don't explain to us, we wouldn't know. We still think, everything is on your hands, is related to your organ, everything. But I know definitely, personally, the channel system is really, really helped, right? Will you agree with that? The channel path?
Help in what sense?
In the sense that help you to identify the points, will really hoping to cure.
It just amazes me how you can find all this literature going back 2,000 years that these practitioners kept records of what they were doing, what was efficacious, what was not efficacious, because you have a whole genre of what was not efficacious, and coming back and treating it correctly. But the empirical information of all those treatments and observations gathered is quite extraordinary. I do have to say one thing, though, is that certain things have been confused now with regard to understanding of certain diseases. And that's particularly because, one of the difficulties in East Asian medicine is that you're dealing with ancient terms. And sometimes some of these terms, there's no real clarity what exactly was that disease term referring to, right? But there is a lot of terms that you can follow a certain chronology and understand that that's like 霍乱, right? Or 我忘记了霍乱英文怎么说?
Hey, yes, and sometimes things happening when you're speaking one language for a long time and the other one.
I forgot how to say that in English, but this particular disease, right? I mean, there's enough evidence historically. You have diarrhea and vomiting, and that's that particular. My gosh, I can't believe I can't remember. Anyhow, but for certain things like that, it's clear that was referring to that particular disease. Like if you look at for example, like rhinitis or arthritis. Like rhinitis, for example, you have terms going from the modern term is like 慢性鼻窦炎, right? But you have like 鼻炎, 脑沙, like brain sand. You have all these descriptions that are kind of, sometimes a little bit difficult to decipher unless you read it within a commentary in an ancient text. Right? And I have a good friend that just translated a book on points. He does a great job in illustrating, some of these traditional disease names and when they were possibly correlated to modern times. Yeah.
That's very interesting. For my understanding to you is you are really diving into a very, very deep to understanding old Asian literature and then make sure that you have full understanding to the things that you practice. That is very, very amazing. So I think by the end, since you doing a lot of literature, and then what is your practice based on right now?
Well, right now I basically treat, what I've personally like to treat is people that have individuals that have, unfortunately, have like neuropathy, kidney, renal issues, gastrointestinal issues, because that's where I see the most benefit for these individuals. A stroke. I mean, one thing that happened with one of my stroke patients, I mean, he came in a wheelchair and he was getting treated for, I was trying to get him to come in twice a week, but it wasn't possible. But after the third month, because I'm currently on the second floor, but I'm actually moving here pretty soon to another location. And I typically would have to pick up in the lift. I mean, one day after 3 months, he just shows up by himself, sitting in the waiting room. And I was like, how did you get up here? And that was great to see, and I had forgotten how powerful acupuncture is, because typically, an individual like him that had a stroke and had paralysis, it takes about 6 to 8 months for them to start really getting mobile. So you see those things and really gives you satisfaction when you can help someone that way. And my neuropathy patients, after a month and a half, they start feeling their feet after 2 months, because I use a lot of needles with neuropathy patients. I use a lot, and it's amazing. Like the first couple of weeks, they won't feel a thing. Then they're able to become more independent, able to drive, take trips. It just amazes me.
Yeah, that's amazing. So in terms of what I'm trying to get out from this is like, with all of the things that you learn from different theories, are you practicing certain one that you like, or you combine all of them?
I would have to say I'm quite eclectic in that sense, to separate that in my head, I try to keep everything separate, However, sometimes you can mix certain things, especially, this is more important when it comes to herbal medicine prescription, keeping things separate. Because you really have to understand like the particular paradigms, how these herbal formulas are constructed, right? Unless these formulas come from a formulary and doesn't have a particular theoretical idea behind them, because there is a whole, compilation of different formularies that actually were just, individuals saying, oh, this herb is good, or this herb combined with this herb is good, but it's not a physician thinking about, the pathomechanism behind it, or his idea, his particular theoretical framework that he's using to create it, right? But with acupuncture, I think acupuncture is quite forgiving in that sense, where you can use, different theoretical systems. You could use a microsystem with a body system, for example, right? You could use a microsystem, basically is like the ear or scalp or hand acupuncture, like in Korea, so juk. And you can still use like body acupuncture. So from what I learn in different places, I kind of I try to employ whatever is more effective, basically.
Yes, I'm 100% agree with you. It's the same thing whenever you learn from school, you're always trying to learn from other people and then expanding your knowledge and then get the best results for the clients or patients, right? So I have a question for if people want to reaching out to you, how they can be able to connect with you.
Go to my website, Evans or Acupuncture, and they can contact me through there, or just call the office at 405-397-2952. And here, I think middle of this coming month, we'll be in a new office space at the Physicians Building, downtown Oklahoma City, or Midtown Oklahoma City, they call it. And anybody's welcome to call and ask for whatever concern they have. Yeah.
As you know, what makes this podcast different is our guests will get a massage from Man Massage and Spa. And
yeah, looking forward to that.
We haven't scheduled yours yet. We definitely need to schedule your in, and then to see like how was the experience, and then you can let us know how is that for sure.
Yeah, definitely. Is there a particular like method of massage that you practice, or?
Okay, so for me, like we are more like a therapeutic massage. So what I learned is like I learned from school, and then I went back to the person who helped me for internship for a month, and then he just so busy, so I couldn't be able to practice a lot. And then I pick up with other massage therapists, whatever the things they do is effective, then I will implement it. And then when I see the results, and then that's how we combine what we can do for the best results. So main things for us is like more like muscle related chronic pain, like especially when people have a lot of knots. So we're trying to break it down, and then among with trigger points, trying to find out where is the trigger point, and then manipulate and make them to release, so they can be able to like less tension on their muscles. So that's what we are. So the reason I'm trying to combine all of the people here is, muscle everywhere, right? Everywhere in your body has muscles. With different people have different knowledge, especially as you from like traditional medicine, and then understanding of acupuncture. So we can be able to like working together and helping up with like a holistic approach to helping up more people, so they can be able to pain-free, right? So that's my goal. That's why we create this podcast. So last but not least, so I have a question for you is from the acupuncture or traditional Chinese medicine perspective, what are the self-care tips that you want to suggest for our audience they can take away from you, so they can practice at home, so make them more proactive on their health?
Sure. A couple of exercises I gave to one of my IVF patients, because she asked me this particular question. Basically, it's something that a lot of people traditionally do in like Taiwan and China, which is they do like moxa, aitiao, right? On Susan Li, there's a point, stomach 36 is quite popular in Taiwan, particularly, stimulating the stomach 36 with moxa, which is this mugwort herb. Also, massaging the point also is, and also like using ganjiang, ginger, dried ginger, sliced, put it over your belly button, and also burn. But you have to be a little bit careful. Maybe you don't want to do that. But put aitiao. Aitiao is mugwort. It's an herb, a plant that's dried and made that, according to tradition, has a warming, supplementing action, in the body. So on the body, excuse me. And typically it's used either directly on the skin or indirectly with a little pole, or sometimes they make it into a cone and they put it like on a sliced piece of ginger or suanto, garlic. Yeah.
Okay. Do you have all the stuff that you said at your shop? So people, if they need it, so they can find out from you?
Yeah.
For example, I tell anything like that?
Yeah, I have it. I can't really use like this. I try to use the smokeless moxa, the one that doesn't create that much smoke, because moxa unfortunately smells like pot. Calling the cops on you here in Oklahoma. Well, not anymore. Now they're saying, "Are you smoking pot in there?" Oh, it's teasing. Things have changed when I left.
Hey, yes, that's the thing, right? Everything is changing now.
Yeah, things have changed.
Yes, yes. That's awesome. So yeah, this is a great conversation. I think people get the inside knowledge about acupuncture and then a little bit deeper on the historical about Chinese medicine and everything in general. And thank you so much for give us this great conversations. We understanding a little bit more in depth. So my last question is, what else that you want to talk into our audience? I know that you are going to come into our chronic pain event speaking at the events, right? So is there anything that our audience can take away from that event? What are you going to talking in that event?
Well, basically, I'm going to go by far much more in depth about the mechanisms of the modern understanding of the mechanisms of acupuncture, as well as some studies, that meta studies that have provided some really good solid evidence. The funny thing here in the US is that, there's only particular groups, doing research on the efficacy of acupuncture. And there is contribution by other countries too, but what it exists in the medical literature in China or, Korea, Taiwan, by far supersedes any research that's done here in the West. There's so much evidence, that's why it's very much accepted in East Asia, because, it's not just because it's part of the tradition, it's because it's efficacious in treating, a lot of maladies. But yeah, for the conference, I'm going to go into basically that. And
if someone who's, I'm in hurts, can you showing out how you're going to do it?
I wasn't planning on it, but we can do that. We can bring some people with, lower back pain or chronic pain and, see how they respond. And, the thing is, what people can say about that too is that, placebo effect, which could be, it's very legitimate too, but I would like to see somebody that's been, have had chronic pain for a number of years, not just a week or so. That,
Yeah. So what are we going to do? We're going to pick out the participants, make sure, ask them, hey, who has chronic pain for several years?
Yeah.
More than 10.
Yeah. And we can see, because, there's good systems to take the pain away rapidly, but, to maintain the pain, from coming back is a different thing. You can take the pain immediately away, with treatments, with a treatment, but to truly resolve that issue, it takes multiple treatments.
All my clients, I always suggest them, hey, you do it continuously, such session or anything like that, so you can see the longer result. And sometimes you have to consider as a maintenance, like your car, right? So you want to
do exactly. The beautiful thing about acupuncture, people don't understand, is that all these neurochemicals that are released, not just endorphins and enkephalins, but also to the degree that you can release some stem cells, anti-inflammatory factors. Acupuncture to me is one of the best things for inflammation, to bring down inflammation rather quickly. But it takes that kind of stimulation, frequent stimulation, to cause healing. You'll feel good, and then you'll go home and start hurting again.
Yeah, yes, I agree with you. See, yes, this is I'm super excited about that. And then I can't wait to seeing you on our chronic pain event on November 4th.
Looking forward to it, yeah.
Yes. So now let's getting ending on here today, and then I will looking forward to seeing you on November 4th. How is that?
That sounds great.
Thank you
nice
so much
to meet
for
you.
your time.
Thank you, Margarita.
Yeah.
很高兴认识你呀。
Yeah, same here. Yes, 很高兴认识你呀。
Remember, being proactive about your health is the first step towards a brighter, healthier future. So until next time, keep that go-getter spirit alive. Stay proactive and never stop pursuing your wellness dreams. Connect with us on Instagram at Healthier Go-Getter. Check out more great interviews at mammassageandspa.com or follow us on Spotify, Apple Podcast, or any other podcast platform. This show is for educational purposes only. Contact your doctor or physician for any health concerns.